Hello and welcome to ukfitnesshub.com. My name's Travistarrant, and in today's video we're going to be going through TFCC Tears, also known as the Triangular Fibrocartilage Complex. We're going to be going through what it is, what it does, and also some rehabilitation if you have a tear. Let's get into the video. Before we get straight into the exercises to repair a tear, it's really important, especially for a new patient, that they understand exactly what they've done and where anatomically they've injured. That way, when they go into the exercises later on, they can kind of see the benefits, and they can also understand a little bit about what the actual anatomy of the tear is. So what I want to go into straight away is just these two bones here. So these bones are the bones of the forearm, and we've got the ulnar and the radius bones. Now, as we come into the hand and wrist, you'll notice it gets all a little bit complicated. So what we're looking at is this bone here called the lunate, and this bone here called the triquetrum. Now there's two ligaments we're interested in, which is the ligament that attaches from the ulnar bone to the lunate and the ulnar bone to the triquetrum. So what are those called? They're called the ulno-lunate and the ulno-triquetral ligaments. So what happens is generally somebody who has fallen in this position, they've fallen flat with their palm out, they've got so much tensile force that's gone through that joint, that wrist joint, they end up getting a traumatic injury through the TFCC. So the amount of force they've landed with supersedes the strength of those ligaments, and then they either get ruptures or tears, sometimes mild all the way to severe. A rupture is where the ligament completely detaches off the bone. A tear is where there's fibers of the ligament that have broken away. And the grades of tear are put into 1, 2, and 3, 3 being the worst and 1 being the most mild. Now, there is another type of person that comes in with TFCC injuries. This can be professional sportsmen and women, or alternatively people that have a trade where they use the wrist and forearm very, very frequently in their job. So let's take one of the previous patients I had with this injury. It was a tennis player. Now, you can imagine with a tennis player, they're constantly doing this as they're serving back. So what it was in the individual's case was they actually had good strength in the forearm, good strength in the wrist, but due to the repetitive motion of the forward and back flexion and doing too much of it over time, that had caused some tears within the TFCC. There is also another ligament, which is the ligament that attaches the ulna and the radius, which is the radio-ulnar ligament. And that also can get torn in this. So I'm going to put on screen now a picture of the TFCC so you can see the ligaments rather than me just speak about them. But that's essentially the anatomy of what we're trying to fix. So the exercises that I'm going to cover are for the first stage of rehab. This would either be someone with a mild tear or alternatively someone that's had surgery and they are being told now that they can start to work on active range of motion exercises. So we wouldn't have a weight at this point, but what you would be looking to do is to get your flexion and extension of the wrist. So flexion of the wrist, extension of the wrist. You're also looking to get your pronation and supination. So supination, think you're holding soup, pronation, the opposite. Now, what I do is I actually get my clients to do this with a ball. Now, it would be very easy to do 15 reps one way, 15 reps into flexion, 15 reps supination, pronation. However, that can be horrifically boring. So what I like to do is use the ball. Now I've got a little bit of active stability going on here because the ball moves. And what I get them to do is come into flexion with the ball, roll back into extension. So you can see from the side, that's the extension, that's the flexion. And I'd get them to do 15 each way. So that would be 1 repetition, 2 repetitions. If you don't have a ball, nothing of this size, you can just simply do your extension 15 times and flexion. You can do these every day, so this would be your first stage. You're trying to initially get that range of motion back. Let's say, for example, you get into extension and you go, okay, that's as far as I can go. Just work within that range. So do your repetitions within that range, and eventually you'll be able to get more and more into extension, but just don't push it, listen to your body. Once you've done all of those, I then get the ball and we do pronation and supination. So again, supination, holding that bowl of soup, pronation the opposite. If it's too much with the ball, this ball doesn't really weigh anything, so it's a very squishy ball. I'll put this as a link in the description if you did want to buy it, and you can always deflate the air out of it, but having something to hold and a little bit of stability makes it a much more engaging exercise for your 15 repetitions. And just like the other one, it would be 1, 1, 2, 2, and you would be going to 15. The final range of motion exercise is ulnar and radial deviation. So hopefully you'll remember from earlier, we spoke about the two muscles of the forearm. We had the ulnar bone and the radius bone. So if the hand moves in the position from pinky finger towards the forearm and the ulnar bone, that is ulnar deviation. If the thumb, however, moves in the direction of the forearm, that is radial deviation. Now, if I show you on me so you can see, this, again, pinky finger moving towards forearm, is ulnar deviation. Thumb towards forearm, radial deviation. You would do both of those for 15 repetitions. With all the exercises I've covered so far, you can do 1 or 2 sets, dependent on where you're at in your recovery and what you feel is comfortable. You can do all of these back to back. 15 repetitions is the target. That doesn't mean to say if you used to get to 6 or 7, it was really hard, you could stop there and eventually progress the repetitions. What we're now going to cover is to stretch the forearm flexors and the forearm extensors. So there's 2 ways we can do this. There's the beginner version and a more advanced version. So we're going to start with the beginner version, and you're going to do what's called a prayer stretch. So you're going to pop your hands together, palms together. This is going to be for the forearm flexors, and you are going to come down. So you are pushing away from your body and down at the same time. And I feel this immediately in those forearm flexors. For some people, that's going to be enough, and they won't need to go onto the abrasive version. The opposite of that for the extensor muscles is you would have your knuckles together, backs of the hands together, and this time you would come up. So as opposed to coming down like the last one, you're coming up. And you can hold these 2 stretches for 15 to 30 seconds, and you can do this up to once or twice a day. Now, for the abrasive version, if you want to go that extra step further, and again, remember what I said earlier, we don't want any pain during these, any sharpness, any real bad discomfort, that's an indication to stop immediately. You can come into a position where, right now I have my hands on the massage bed. I don't feel anything in this position, so I'm currently like this, so you can see side on. However, when I come back, I now start to feel that quite substantially in my forearm flexors. For the extensors, again, it's hands down. However, the backs of the hands are in contact this time with a massage bed, and then I would come back again, and I start to feel that immediately into the extensor muscles. Now what we're going to move on to is the next stage of rehab, which is how to strengthen up the muscles and ligaments of the hand. So let's get into that next. So I find with patients the best way to strengthen up the ligaments of the TFCC is through putty. So I generally make them do the putty to time, and you can get loads of different putties from extra soft all the way to really substantial and hard. Now with this one, it's just an extra soft, just so I can show you. Now there's loads of exercises we can do. I could name probably about 12, but I'm going to show you the best that I want you to do. So we're going to take the whole putty, okay, and the first one is to pop it in the middle of the hand, and we're just going to start to squeeze into it. So I'm working the putty, trying to squeeze into it. I'm feeling these forearm flexor and extensor muscles engage. You're trying to recycle with the thumb and you're pressing in with the fingers. Every single one of these exercises that I'm going to show you, you can do for up to a minute. If it's too easy for a minute, then what I would be more inclined to do is up the actual resistance of the putty, but start off with a really weak putty just so you can get used to it. So that's the first one, where we just start to get that strength in the hand, and the thumb is always the finger that resets for the rest of the fingers on the putty. The next one, I'm going to break off half of the putty. What I'm going to do now is I'm going to use my thumb only, and I'm going to press my thumb into the putty. So press the thumb into the putty, press the thumb into the putty. What I can also do is get the putty like so in my opposite hand, and I can try to extend the thumb like so. Again, thumb into the putty, put it round, and I'm extending the thumb. This is going to be quite a difficult one. Last one, extending the thumb. So I'm trying to bring the thumb into that position for that one, and the previous exercise I was doing the opposite, I was bringing it the other way. What we can then do, again with half the putty, is we can start to do finger to thumb on each of the fingers. So work through the putty, again make it a ball, finger to thumb, finger to thumb, finger to thumb, and finger to thumb. What we can then do is we could start to do some kneading. So this time, we're going to do the opposite. I'm going to bring the fingers in a position where they're together. And now I'm going to push away with the putty. Fingers together. And then away with the putty. So I'm trying to break the putty apart. Showing you to the camera. Away from the putty. The last two exercises that we can do are adduction and abduction of the fingers. So what I want you to do is get a really small ball of putty. Okay, and how we do these exercises is the first one, we are going to bring the putty in between the fingers, and I'm going to squeeze in with my index finger and my next finger. What we're going to do then, in between the next two fingers, and we're going to squeeze in. Finally, squeezing in. You can see how hard that last one is for me, and I've got no TFCC tears. So this is one that you would do with the softest of putties that you could possibly get. Again, I'll put the putty in description so you've got it if you need it. What we can also do is do the opposite though. So this right hand that the putty is in is not going to move at all. What is moving, however, is my pinky finger in the direction of the putty. So now, as opposed to the fingers coming in towards each other, I'm now pushing away. And we can do this with all the fingers as well. And I'm going to push away into the putty. We already did extension and flexion of the thumb, so that's already done. So this would be specifically for the fingers. And really that's all the exercises you would need to restore your TFCC, to heal it, to get it stronger, to get the mobility back in the wrist, and also as well get the strength back in the ligaments. And that concludes the end of this video on TFCC tears. I hope you've enjoyed the video, and if you have learned something new, be sure to click like on the video and subscribe to the channel for more free and educational content. As always, you've been watching UK Fitness Hub. I've been Travistarrant, and I'll see you in the next video.